by the plague. Okay, 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 plague. Okay. So Yersinia pestis is a gram-negative. Yersinia pestis is a gram-negative oval cocoa bacilli. Okay, so which shows a bipolar staining and pleomorphism. Pleomorphism means which is present in a different shape in a single slide. Okay, it is non-motile and of mankind actually. So you can flee. So you can see here. 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 So this is the. So this is the. So this is the vector. Which transmit the Yersinia pestis. Okay. So plague cycle exists in two cycles. One is domestic cycle, which occurs between humans, rat, flea, and rodents. So wild cycle, which occurs in nature among the wild rodents. Okay, so in plague, mainly we have two different cycle, domestic cycle and wild cycle. So this is the picture of rat flea, which feeds on the infected rats and which transmit infection to the human beings. So mode of transmission, how the man get infection? By the bite of infected rat flea, direct contact with tissue of infected animals, and droplet inhalation, means from man to man transmission. So virulence factors of this Yersinia pestis includes factor 1 antigen, which is a capsular antigen. As it is a capsulated bacteria, we can see the capsular factor 1 antigen. Then murine toxin, which promotes the survival of Yersinia pestis in the midgut of the infected flea. Okay, so in flea it has to survive, right? So how it will survive? With the help of Yersinia murine toxin. Then we have surface proteases, which they activate mammalian plasminogen and also degrade the complements. Okay, so basically the blood clotting mechanism it affects. Then we have pH6 antigen, which is present on Yersinia. It binds to the host lipoprotein. Okay, then we have most common, which is present in gram negative, that is lipopolysaccharide, which possesses the endotoxic activity. And it produces a pigmentation. Okay, where it will produce the pigmentation? The media which contains the hemin. Okay, so which produces the brown pigmentation. So coming to human plague, very important in exam point of view also in RGHS B.Sc examination. So human plague occurs in three or different clinical forms. One is bubonic plague, next one is pneumonic plague, and one is septicemic. Okay, so three clinical forms of plague we can see here: bubonic, pneumonic, and septicemic. It's common type. Okay, compared to other two. So this one is the most common type of plague here, which is transmitted by the bite fever, malaise, headache, and painful. So here lymph nodes are affected mainly. Okay, buboes means what? Bubonic plague, the name. Okay, buboes means regional lymph nodes appear as tense, tender, and swelling, called as buboes. Okay, so the swelling or the tenderness of the regional lymph node, we call it as buboes. Okay, so most common site being the inguinal region. Okay, but it can affect to any lymph nodes. Okay, so without treatment, dissemination occurs, leading to pneumonia and meningitis. Okay, so if you didn't treat, if you left untreated, so it can spread to any different organs and may causes the pneumonia and meningitis. So next is a pneumonic plague. So primary pneumonic plague results from the droplet or inhalation. Okay, inhalation of the bacilli which is expelled from the other person. So here incubation period is about 1 to 3 days. The onset is same, but here mainly by the inhalation of the droplet we are getting the infection. So respiratory system is involved here. Okay, so we'll be having productive cough, then difficulty in breathing and chest pain. Okay, so next is the systemic plague. So primary systemic plague is rare, but accidental laboratory infection. So most common is bubonic plague and your pneumonic plague, but accidental inoculation, maybe through we say it as laboratory infection, so we may get the septicemic plague. Okay, so which develops following the spread of bubonic and pneumonic plague. Okay, so here if the septicemic plague is happening, so it is a life threatening because of the massive involvement of the blood vessels. Okay, and we can see the hemorrhages here. Okay, so may lead to gangrene also. So when we are handling the sample which we are suspecting plague, so we should be very careful. Okay, so coming to the laboratory diagnosis, so specimen is very important here in case of bubonic plague, which involves the lymph nodes. So we'll be taking the fluid from the buboes, or pus we can collect if pus is available. So pneumonic plague, we usually take the sputum. And in case if you want to go for antigen antibody reaction, we will take the blood. Okay. In septicemic plague, we take, septicemia. So usual specimen of choice is blood here. Okay, postmortem, then we can take the splenic aspirate. Transport media, yes, if it is delay is there, then we'll go for transport media. Okay, so once we receive the sample in the laboratory, we do gram staining, so which reveals the gram negative oval cocobacilli. Okay, then special staining is there to check the bipolar or safety pin arrangement, that is the Wesen staining. So Wesen staining generally we do to see the bipolar or safety pin arrangement of the Yersinia pestis. Okay, so you can see here both gram stain and Wesen staining pictures. Okay, so next is the culture. So on blood agar, I told you the media which contains hemin, so which will produce as the brown pigmentation. Okay, so it is an facultative anaerobe, so which grows best at 37 degree. So blood agar, it will show the brown pigment as it contains the hemin. McConkey agar, non-lactose fermenter, then nutrient broth, granular turbidity we can see here. Okay, so this is the picture of Yersinia pestis on blood agar. Okay, so this is the granular turbidity which is produced by the Yersinia in the broth, nutrient broth. Then biochemical reaction, if you do the sugar fermentation, so it ferments mannitol, glucose and maltose with production of acid but no gas. So acid production you can see without the gas formation. It is catalase positive, oxidase negative. Indole urease and citrate test are negative. MR is positive, VP is negative. Generally, we do ELISA for antigen detection. So, there are different virulence factors. One among them is F1 antigen. So, we take the aspirate, right, from the buboes. So, we can do either immunofluorescence, ELISA or any other antigen antibody reaction to find out the virulence factor, that is a FA1 antigen. Then antibodies to FA1 antigen. If antigen is present in the body, then antibody should be present. So which can be detected by either complement fixation or ELISA or any agglutination reaction. And most commonly used method. Okay, nowadays we want result fast. We not go for conventional method, we go for molecular method. We can use PCR, okay, for the detection of F1 antigen. Coming to the treatment, okay, so very important, because we know the mortality rate is very high when we get the plague. So early we have to start the treatment when we observe the symptom. Okay, so streptomycin antibiotic is a drug of choice used in past, given for 10 days. Gentamicin is currently recommended for treatment, and alternative drugs available are doxycycline and chloramphenicol can be effective. Okay. So prevention, we have prevention is better than cure, right? So vaccines we have for plague. So formalin killed vaccine is present. So subcutaneously 2 doses for 4 week apart. Okay, 1 dose you give today, and after 1 month you take another booster dose. Is it is not long lasting, but if you are working in the veterinary and you are in the section where you are working with the plague samples and all, recommended to take the vaccination. Okay, thank you. If you have any query, drop questions in the comment box. I'll be happy to answer your questions.